Rudy Reines here with lab report number 3. I have my drawings, my skeleton, and the list of words we'll be going over. First up, we have the basement membrane, which is the layer here where the epidermis reacts with the dermis. Here we have the blood vessels starting off in the hypodermis, working its way up through the dermis. The epidermis is the outermost superficial layer of skin made up of 5 different layers. The keratinocytes are the cells here with the nuclei. The hypodermis is this bottom layer, composed of like adipose tissue, the blood vessels, the subcutaneous layer. Melanocytes here found in the stratum basale provides the color. The layers of the dermis is the papillary layer here, denoted by like the loose lines of connective tissue. The reticular layer here is more dense connective tissue. The stratum basale, mentioned earlier, is the deepest layer of the epidermis, where the melanocyte is contained. The stratum corneum, the uppermost layer of mostly or all dead skin cells, and here's some flaking off. The stratum granulosum is the middle layer, and you can see the granular texture of those. The stratum lucidium is the second layer here, thin layer in between the granulosum and the corneum. And then the stratum spinosum with the spines connecting each other, which show up on stained slides. And then here's an eccrine sweat gland, produces a hypotonic sweat for thermoregulation. Moving into the bone. So we have the blood vessels, or vein and artery, blue, red. The caniculi are part of the osteocyte here. The canals that connect different osteocytes. The central canals are where the blood vessels and the nerves come in. The circumferential lamellae and the concentric lamellae. So the lamellae are the rings. Circumferential lamellae and circumference like the entire bone, as to where concentric lamellae are the circles surrounding the central canal. The lacunae is the area where the osteocyte would be. The nerve, again, the yellow coming into the central canal. The osteocyte, that's an individual osteocyte here, and then they're portrayed in the bigger picture by the darkened cells there. The osteon is the series of circles, area of concentric lamellae. So that's an osteon, that's an osteon, that's an osteon there. And the periosteum is the outer layer of tissue surrounding the bone. So, onto bones themselves. We have the cervical vertebrae here, which there are 7 of in the neck. The diaphragm, the parachute muscle on the bottom of the ribs there. The external abdominal oblique would be the lateral aspects of the abdomen. Your frontal bone, your hyoid bone located in the neck, the base of the mandible. Lumbar vertebrae, the lower spine, be 5. Mandible, the lower jaw. Maxilla, the upper jaw. Nasal bone. Occipital bone. Back here. The occipital bone here, followed by the parietal bone down here. Rectus abdominis muscle is your anterior portion of your abdomen. Your sacrum, which is the 5 fused vertebrae there in your coccyx, 3 to 5 fused vertebrae there. There's sphenoid bone located on the side here. And then sternocleidomastoid inserts in the sternum and inserts back there on the mastoid process. So there is your sternum. Go down there. Temporal bone here. Thoracic vertebrae, these 12 with the ribs. Trapezius muscle, the upper back, responsible for like shrugging motions. And then the zygomatic bone,